Okay, how's it going everyone? Dr. Tom Walters here from Rehab Science. I want to talk a little bit about low back pain today. Low back pain is obviously really complex. It's the most common issue that people come into physical therapy for. Nobody's got a perfect fix for it. You might hear that online, but it's if we knew there was a solution that fixed everyone, everyone would know about it and somebody would be making a lot of money. So it's just not the case. It's really complex and different things work for different people. One area we found that's helpful for a lot of people, there's been some studies published on this, and I'm going to refer to one study today where we found that training the hip muscles can actually help the low back in a lot of cases. And this particular research article looked at 3 hip exercises. So I'm going to demonstrate those for you, and if you have low back pain, you can try these at home and see if they are helpful. So all of these exercises tend to work the glute muscles, and for some reason we don't fully understand the mechanism. Working the glutes often helps the low back. So if you've got low back pain that's sort of specific to your low back, it doesn't refer down your leg, sciatica-like symptoms, then these exercises likely would be helpful for you. So a good rule of thumb is to shoot for 2 to 3 sets of 8 to 12 repetitions. These exercises don't require any extra equipment. There is one that a resistance band can be useful for. I don't have one with me right now, but if you've got one of the loop resistance bands, you can use it in one of the exercises, and I'll mention that. So you might try these 3 times a week, 3 to 4 times a week, 3 sets, 8 to 12 repetitions. So the first exercise is one called a kickback, and so what you're going to do is position yourself on your elbow, on your forearms, and then you'll work both sides, so make sure you work both legs. I'm just going to show one side for demonstration purposes. But what you're going to do is you're going to be down on your forearms. You're going to try to keep your back, kind of find not too arched, not too rounded, kind of find a neutral position. And then you're going to start with one leg. The knee is going to be bent at 90 degrees, and I'm going to kick that leg straight up, just moving my hip. The key is, as your hip comes up, don't let your back arch. So keep your low back in the same position. Kind of find that middle zone. Bring your hip up into extension. You'll squeeze your glute and then back down just to where your knee touches, and then back up. And again, you'll shoot for 8 to 12 repetitions on this until you feel a sense of fatigue in that hip region. And then you'll switch to the other side. Okay, so that's the kickback. That was one of the 3 exercises in the study. The next one is a clamshell. A lot of people are familiar with this one. You basically just lay on your side. This is the one where if you've got a loop band, you put it around your feet and pull it up around your knees, and that band will add extra resistance. But basically you're going to lay legs touching to start with, and you're just going to lift the top knee like a clamshell sort of opening. The ankles and feet stay together. So you're just going up and down slowly. This works the glutes on the top side. So just moving through that movement, again, somewhere around 10 repetitions, and then move over to the other side. So you can imagine if I had a band here, it would be around my knees, and it would be adding resistance as I move through that movement. Okay, and then the last exercise is a single leg bridge. Another one that many people are familiar with. You're going to lay on your back. Again, we'll do this on both sides, hands down at your sides for balance. Your knees will be bent somewhere around kind of the 90-degree mark. The leg that you're working will stay on the ground. The other leg will straighten. And all I'm going to do is push into the ground with this leg that's down and lift my pelvis up until there's a straight line from my knee to my shoulder. So I'm just going to do repetitions like that. Again, shoot for 10 nice, slow, controlled repetitions. And then you'll repeat on the other side. So again, if you have low back pain and you're looking for something to do at home to try and help that issue, give these 3 hip exercises a try and see how your back responds. I hope this is helpful. Thank you.